Alright guys, so while you're listening to this PowerPoint, make sure you're filling in your notes. We are going to be checking to make sure that your notes are completed before our lab tomorrow. So we're going to go over types of drugs. Before we do, you need to know that a drug could basically mean two different things. The first one is it could be illicit or illegal. That just means that there is no accepted medical use in the United States. So that would be something like heroin. Okay? Then you have controlled substances. Controlled substances are legal. Okay? You might be prescribed a controlled substance, but it's restricted because these drugs might have harmful side effects if they're used continuously, and they also might have potential for being abused. Drugs can fall into several different classes or classifications. The first one we're going to talk about is narcotics, but then we're also going to cover hallucinogens, depressants, stimulants, club drugs, and steroids. So the first thing we're going to talk about is narcotics. There's a variety of narcotics. The first one that we'll go over is opiates. That just means that it's derived from the Asian poppy plant. And examples of this would be heroin, morphine, or codeine. Then there are synthetic or man-made opiates. Okay, you can remember that because synthetic just means man-made. And methadone is a great example of a synthetic opiate or a man-made opiate because it's used to wean heroin addicts off of being addicted to heroin when they're in a hospital or when they're just withdrawing. Then you have oxycodone, which its common name would be Percocet, and then hydrocodone, which would be Vicodin. An overdose on narcotics could result in difficulty breathing, low blood pressure, and if you think about it, if you are consistently having low blood pressure, you will lose consciousness, and you could end up going into a coma or dying. The next class of drugs we're going to talk about is hallucinogens. So hallucinogens will actually alter the individual's perception, their emotions, their self-awareness, and just how they're seeing the world and thinking. Some hallucinogens could even cause panic attacks. When I used to work in a hospital, I worked in the emergency room sometimes, and a lot of times if we had somebody coming in that was on drugs, specifically mushrooms or LSD, they sometimes were having almost what they would call a bad trip, where they might be seeing demons or spiders. And these hallucinogens, they could cause seizures, headaches, very severe headaches, sometimes psychosis, which would be like a state of craziness, and that wouldn't just last for a few hours, it could last for weeks. Many hallucinogens, in particular PCP, actually increase the individual's heart rate so drastically that it could lead to heart failure or heart attacks. And there are a lot of different hallucinogens. The most common hallucinogen that you hear about in the United States is marijuana. It's actually the most widely used illicit or illegal drug in the United States, and it contains THC. You're going to see tomorrow in our lab, you are going to be testing an individual's urine to see if it actually has THC in it or not, so you can decide if that person had marijuana in their system. It does have medical uses, however, such as treating glaucoma, or sometimes people who have cancer and are receiving chemotherapy, they're incredibly nauseous, and marijuana does relieve that nausea. So in some states this is legal, however in others, as we know, it is not. Then there's MDMA, which is ecstasy, okay, and mescaline, which would be like peyote. Oh, and LSD, which is just like acid, PCP, which is angel dust, and as I mentioned earlier, mushrooms. So depressants. Now, depressants, you could remember this because if you think about it, when you're depressed, you sleep a lot, you're tired. Well, depressants decrease your heart rate, okay? And depressants sometimes are used to relieve anxiety and produce sleepiness for somebody who's having difficulty sleeping, okay? These depressants will reduce your body functions. As I said, it's going to decrease your heart rate. It's going to make you very sleepy. If too many are taken, then it could cause the individual to go into a coma, or they could even die. Something that is very, very dangerous, that is done more than it should be, is that individuals sometimes mix depressants with other drugs, whether it's another stimulant, another depressant. Regardless, it can have serious effects on your heart and very, very other serious health risks. So there are a variety of depressants. Alcohol is the most common one. Then you have barbiturates, which would be those downers. And you can remember that it's a depressant because if you think about a downer, you're decreasing your heart rate. Okay. Then there's also anti-anxiety medicines. That's going to be your benzodiazepines, which would be Valium or Ativan or Xanax. Then there's also inhalants, sedatives, and muscle relaxers, right? If you think about it, if somebody is given a sedative, they're going to be very, very sleepy because their heart rate's being decreased. And lastly, marijuana and opiates, which would be like morphine, are also considered depressants because they decrease your heart rate. Now we're going to talk about stimulants. Well, we talked about how depressants were downers. Now we're going to look at stimulants, which would be called uppers. The reason they're called uppers is because it actually increases your heart rate. Okay? It increases your energy, your heart rate, makes you more alert. But at the same time, it's also going to be decreasing your appetite. Okay? Depression is a very, very serious side effect for an individual who is addicted to stimulants because when they're on a stimulant, it has a tendency to make their brain secrete more dopamine, which would be like that pleasure hormone, okay? And if they're used to having abnormal or unusual, I should say, levels of dopamine when they're off of the stimulant, they're going to have just these feelings of depression because they're not used to what normal dopamine levels feel like. Stimulants, because they are associated with this pleasure hormone, are very, very addictive. And an overdose can result in irregular heartbeats, heart attacks, strokes, seizures, coma, and even death. There's a lot of different types of stimulants. There's amphetamines, cocaine, which is something that you see a lot in movies. This also includes crack cocaine. So cocaine is derived from South America, and addictions to cocaine are very, very difficult to overcome. Another example of a stimulant would be methamphetamines, also called meth or crystal meth. So typically methamphetamines are more potent and dangerous than amphetamines. If you look at this woman to the left, this was before she was addicted to methamphetamines, okay? And then if you look at her just 2.5 years later on the right, that's what she looks like. Okay, so it completely deteriorated her. And if you think about it, that's what she looks like on the outside. Think of how bad she must look like on the inside with her brain. Specifically, all of the hormones must be completely out of whack and not at the proper levels that they should be. So the next class that we are going to talk about is club drugs. So club drugs are called club drugs because, well, they are most commonly used in clubs, bars, raves, and just crazy dance parties. So there are varieties of club drugs. MDMA, also known as ecstasy, is a very, very popular one. That's also known as a pleasure drug because it causes hormones to be released that cause the individual to feel a lot of pleasure. Though chronic use could actually cause the body to break down. You could have severe brain damage, memory loss, and seizures because if you think about it, it's causing your brain to do things that your brain is not supposed to be doing. Okay? Another example of a club drug is Special K. And that's actually used by veterinarians as an anesthetic. It could even be used on organisms as big as horses. So Special K is another example of these club drugs. Date rape drugs. So this is a very, very common club drug. It's used on women more often than men for sexual assault, rape, even robbery. And these drugs cause an increased libido, which is essentially an increased sex drive. and at the same time, it depresses the central nervous system. So if you think about it, if it's depressing your central nervous system, it's going to result in the individual to lose consciousness. They'll have no memory of what happened, so they will not know if they were sexually assaulted, raped, robbed, or anything until they wake up, and they're very confused. Examples of date rape drugs would be GHB or Rohypnol, which is also known as a roofie. The last type of drugs we're going to go over are anabolic steroids. So anabolic steroids are steroids that promote cell division of your muscle tissue and growth. So if you look at the woman on the left, yes, that is a woman. You can tell by her bikini, although her biceps do not look very feminine. She is clearly on anabolic steroids. Okay, so if you look at her muscles, she has clearly taken steroids, and there's been much more cell division concerning her muscles, and she's having more tissue growth. So athletes take steroids to increase muscle mass, which is clearly what this woman did. Anabolic steroids are chemically related to testosterone. In fact, anabolic steroids are almost like a synthetic form of testosterone. Okay? And side effects of anabolic steroids include having liver malfunction or liver failure, cancer, breast development in males. If a male is taking steroids and he stops taking steroids, he actually, since he had that synthetic testosterone in his system, that's going to drop, and it's going to affect his estrogen levels. So if you have high estrogen levels, all of a sudden it's going to cause them to develop breasts. Okay, it makes females look manly. Like we said before, if you look at that picture of the woman on the left, she is very, very manly looking, and it decreases sex drive in males. It causes unpredictable moods, which people call roid rage. So one minute you might have a man or a woman that's on steroids, very, very happy, loving life. All of a sudden they're screaming, they're cursing, they're picking fights with somebody, and they're uncontrollable. And then 2 seconds later, they might be crying because somebody hurt their feelings. So it's very, very crazy, erratic behavior. It can also cause personality changes, depression, hypertension, which would be very, very high blood pressure, and high cholesterol. Alright guys, so that's it for our PowerPoint. Make sure all of your notes are filled in, study, and tomorrow we are going to be doing tests to study these different types of drugs.